With a surge of coronavirus patients expected in the coming weeks, an important part of the response in Boston will be from neighborhood health centers. They're not a destination for the most intensive care, but they are accessible to many people with critical needs, and they can relieve some of the massive demand expected at hospital emergency rooms. To tell us what's available at the Harvard Street Neighborhood Health Center in Dorchester is its president and CEO, Stan McLaren. Thank you very much for being with us, Stan.
Thank you. Thank you for having me.
So, I want to ask you, for people who are not familiar with community health centers and people who right now might be worried about whether they have this virus, what exactly can a community health center do for them?
Community health centers can actually screen for the test. We have physicians there that would actually, would see them and help as with regards to their treatment. So I think we play a vital role in the COVID-19 pandemic. And the reason we do is because we're located in areas that that deal with a lot of vulnerable populations. When you look at health centers overall, we're located in urban and a lot of rural areas. And in the rural areas, as you can imagine, places where there might not be hospitals for miles. But yeah, when you come to a health center, you'll be able to get screened for the COVID-19 disease, and to see if you have it, and if you don't, what other things ail you, and what needs to occur once we find out what issues you bring to the health center.
I imagine the advice here for people in the neighborhood is that even if they have just mild symptoms that may or may not be this virus, they should call in early. I imagine that's the case.
Yeah, we have moved we don't have a lot of people come into the health center, in that we've called them and asked to reschedule visits that there may not be critical or an emergency. And because as we're trying to just screen for what's going on in the pandemic, especially as you look at this, the mitigation strategy, right, is for people to stay at home and isolate themselves, or to practice social distancing. And the idea that we're able to call them, Massachusetts just approved telehealth for hospitals, health centers, and so on. So we have the ability now to call, talk to our patients, not have them be exposed to anything by coming to the health center, and to talk to them over the phone in their own home, so that we could figure out what's going on. And if the good thing about that is, one of the main things around these mitigation strategies is to try to prevent a surge on the hospitals. The hospital beds are limited. And if we're part of that front line that would try to help reduce that surge, in that we're talking to our patients while they're home, and then helping them to decide whether or not they really need to go to the hospital. We don't want someone to go to the hospital just because they feel like they may have symptoms of COVID. We want to have a conversation with you to try to figure out what's going on, go through a routine as to what should happen before you end up going to an emergency room, where you may be difficult with regards to getting beds. There's a scarcity of supply. But on top of that, we don't want you, if you're not sick, to go into a situation where there are other people that could potentially expose you, where if you had called us earlier, you could have just stayed home and we could have helped to deal with the situation. So I think health centers are really on the front line, but we also placed in communities that are underserved, that that would have to go, if they have to go to the hospital, if they're not calling 911 to get an ambulance to come, they're having to use public transportation, which would only create only further exposure.
Since the 1960s, community health centers have been dealing with disparities in health. What about the disparities now? Because there are some people who have cars to get around, they can work from home. Maybe in Dorchester, you're more likely to have people who have to go to work, they can't do it at home, they don't have cars, they have to ride public transportation. What does that mean about their vulnerability?
Well, when you think about the individuals that we deal with, they already have a lot of the underlying conditions that will make this disease probably disproportionately affect them. That's really one of my biggest concerns. That's the piece that keeps me up at night, is that this disease will definitely disproportionately affect low-income individuals and individuals that deal with health disparities. For example, I'll give you an example. Heart disease is the number one issue that impacts Black people in America, and that's the leading cause of death. Well, it's one of the underlying conditions of this disease, and so you can imagine what this disease will do in that situation. Low-income individuals, for example, we're saying that you should stay home. Well, there's a lot of folks are living paycheck to paycheck. When you stay home, you're seeing people going to the stores. You watch TV, you see people stocking up on everything. The people that we deal with are not necessarily able to stock up the way others may. And so they'll have to make multiple trips out, or they'll build up a level of anxiety trying to figure out where the next meal is going to come from. At the health center, we have a food pantry. What I've seen lately is an uptick in families using our our food pantry, and we're having to purchase additional food. We get food from food bank to help us with our food pantry, but we also have to purchase certain items. And we're seeing a significant uptick in folks coming to get food. So you have a bunch of issues that low-income individuals are dealing with, that people of color are dealing with, that make them extremely vulnerable during this pandemic. And for me personally, what's been interesting is I'm at the table, and some of those tables where we're having discussions on, what are solutions. And, I guess your life experience does have an impact on the kind of solutions you come up with. I was in one room where they were, the guy that was presenting on how we should address issues on isolation was good intention and everything. And one of the recommendations were for if someone in your family were sick or tested positive, that they should isolate themselves from the rest of the family and use the second bathroom, and maybe go into the guest bedroom or in the basement, in the finished basement, where they could isolate themselves from the family. Well, how I was raised in a triple decker in Dorchester, and we didn't have 2 bathrooms. We had 1. We didn't have 3 bedrooms. We had a 3-bedroom, but 2 bedrooms were real bedrooms, and 1 bedroom was converted from a living room. So, you have to come up with a different strategy and we were a family of 7 living there. So you have to come up with a completely different strategy when you're dealing with that. Isolation means something different for that family. Maybe the couch is something that they're going to have to look at now differently. Maybe people are going to have to take sleeping bags and get on the floor. Maybe people are going to have to walk around with wipes and wipe down the place more. Disinfecting becomes extremely important. So we have to, so health centers, because of the population that we serve, we make those recommendations right off the top of our heads. It's top of mind when we're dealing with our clients, but it's not necessarily top of mind when it comes to giving instructions overall to overall public. So I think we're uniquely situated in that we deal with a particular clientele, and we're able to give sound advice to them that they can use in real time.
Another kind of vulnerability concerns immigrants, because shortly before the outbreak came up in the United States, we had this change of rules about who's a public charge and how that could be an obstacle to either legal status or U.S. citizenship. What does that mean in your neighborhood?
So public charge, just for people who don't know, if you use certain benefits, then you're not eligible. If you're undocumented and you use certain benefits and you're not, those benefits if you use them, make you not eligible to get your green card or citizenship or get to a pathway towards that. Now, as you can imagine, the climate now for immigrants is not that good, and they are extremely suspicious of any organizations. The health centers, like my health center, we've been in our community for over 50 years. So, you know, the counselors that I have developed relations with the immigrant population. When they present, they're presenting that they're concerned that if they get sick, what happens to them? Just given the scarcity of resources, where do they fit when it comes to the pecking order of deciding who gets treatment? You know, they're also in jobs that, you know, they can't take time off, so they can't do this isolation thing. They have to go to work, and then they're put in very vulnerable situations. I think you know, we talk about the front line, and I know we talk about healthcare workers, but a group of workers that's really not highlighted a lot are our maintenance workers, people that are cleaning up, people that are doing those type of jobs that are constantly exposed. But for immigrants, the degree of anxiety jumps up even further because, of course, they're worried about their status. They're worried about if they go into the hospital while they're there, will someone come and take them out and deport them? So those are the type of things that they're worrying about. Fortunately, I think it was mid-March. It was on March 13th for anyone that uses services that because of COVID-19, they're exempt. And so that's what we've been communicating. That actually just came out. We just got some notices on that. So we're communicating that to our immigrant population. I think that the issue with health centers, I think that's what's very important, is we can communicate this because we're a trusted entity. I don't think that anyone could just tell the immigrant population, oh, we're going to waive it for just during this time period, and that they would believe it. I believe that our counselors that are on the front lines, that have been dealing with them for a while, and are a trusted entity, are in a good position to be able to talk to our immigrant population that, listen, this is real, that it's exempt. If you do use services during this time, certain services, health services during this time, it will not impact your status.